Hello everyone, good morning. I'm Steve from UCAN English Tutoring, a pioneer institution that helps you to pass your OET, IELTS and PT academic examinations. I've been helping more than 12,000 students to pass their examinations since 2008, and you could be the next one if you join a course. I do offer a range of courses such as 2-week course, 1-month course, and then the 3-month course. You can choose one of these courses according to your current skills and the scores that you have obtained in your previous examinations. If you choose my course, I'm going to teach you the strategies for each question type in a step-by-step manner with which you should be able to gain more confidence levels and pass your examination in one attempt itself. There are so many students who achieved their desired scores just in 10 days of preparation itself. So if you have got the examination within a week or two or within a month, please give me a call on my mobile number or WhatsApp number, that is +614684808877. You can reach me on my email address, that is steve@ucanenglishtutoring.com. You can also like my Facebook page, that is www.facebook.com.au. Once you send me an email, I would be able to get in touch with you, and I'm happy to assess your first letter and first role play conversation absolutely at free of cost. You don't need to pay anything to get the free correction and assessment along with the score for your first role play and letter. Before we jump on to the assessment and correction video of this OET letter, which is written by one of my students, I would like to provide a gentle reminder in regards to my membership programs on my YouTube channel. There are 3 packages and you can choose one among them that suits your requirements. Silver membership starts at $4.99, which allows you to access all the members only videos that contain useful strategies on speaking, writing, reading, and listening sections. You will be able to access all the A grade and B grade letters, role play conversations, the way we need to analyze the case notes, the way we need to expand the case notes into full forms and things like that. If you become a gold member, you will also receive the 10 sets of materials for your examination, whether it is IELTS, PT or OET. If you become a gold member, you are going to pay $14.99 a month. For the platinum member, I will be able to provide the assistance and support in relation to 2 mock tests for each subtest of the OET, IELTS and PT academic examinations. This means you will receive the tips and tricks on how to perform well in your speaking, reading, listening, and writing as well. Platinum membership starts at $79.99. So when we convert these things into Indian rupees, it's going to be 250 to 300 rupees for the silver membership and 750 to 800 rupees per month for a gold membership, and it's going to be approximately 4,000 Indian rupees for the platinum membership. Let's start the assessment of this letter now. Okay, so you have written down the addressee's contact details on the top, that is Mr. Paul Ferris, manager of Somerset Nursing Home, Gordon Street, Berrytown. That's good. I'm happy with this. And you have given a blank line in between, which is really amazing. So these things can help a lot. And then you have written out the date, that is 16 June 2018. Is that 18? Isn't it? 2018, right? Okay, and then you have written on dear Mr. Ferris. It's better to place a comma after Mr. Ferris. Okay, this is the salutation section. So you have to place dear Mr. Ferris, comma. Okay. All right, so you have written on dear Mr. Ferris, so it's better to place a comma after this. All right, that's a recommendation actually. All right, let's go to the next one. That's the reference details, that is regarding Mrs. Anne Ellis, comma, aged 76. When you write down aged 76, it's better not to use the capital letter here. All right, there is no grammar mistake here, but it is better to use the small letters. So instead of saying aged 76, you can use aged 76 where you write down A in the small letter. All right, let's go ahead with the next one. Mrs. Ellis has been diagnosed with the bilateral multiple renal calculi, moderate bilateral hydronephrosis. Okay, when you write down You know, these two things you should use and in between. Okay, but you haven't done that. Did you place a comma here or a full stop? Is it a comma?
Full stop. Full
But
stops.
it sounds like a comma, isn't it?
Comma.
Yeah, but that's wrong. You should have placed a full stop. Okay, so calculi, comma, it should be calculi and. All right, let's say calculi, comma, moderate. So this should have been written down like this, calculi and moderate. Okay, so it should be and in between. And then the full stop needs to, the comma needs to be replaced with the full stop. So it's hydronephrosis, comma, it should be hydronephrosis, sorry, nephrosis, comma, needs to be replaced with the full stop. Okay, so that's the next mistake. Okay, it should be a full stop. So that's the mistake. All right, let's go ahead with the next one. Okay, she is being transferred back into your facility after her discharge today. Okay, right, let's say she is being, okay, after being, remember that we need to use the third form of the verb only. Okay, the third form is what we call the past participle verb, and as a result she is being, okay, transferred. It's not transfer. All right, she is being transferred. Okay, that's what you should have written down. Okay, is this clear with you?
Yes, sir.
That's the thing. And the other thing is, look at this one. Into doesn't contain two words. It doesn't contain two words. It is one word only. It is a one word only. So which means in and to, let's say in and to, it should be written down like this, into. Okay, all right. And the other thing is, okay, into is usually used with the person. For example, she is being transferred back into your care. For example, if that's the case, it's better to use into. Whereas if it is a facility, you have to use to, not into. Do you understand? For the person, yeah, for a person, it is good to use into, whereas for a facility or you know, for a hospital or a community care or so on, it's better to use to. Okay, is this clear?
Okay, sir. Yes, sir. Yes, sir.
Yep.
Understood.
After her discharge today, perfect. She requires continued care. It's not continue care, okay, continued care or continuity of care and management. So in this case, again, the problem is continue care. Okay, look at this one. This is what? This is the verb. You can't use the verb. You wanted to say continued care, isn't it? Continued care or continuity of care. All right, so either of them is correct. Okay, let's go to the next one. On admission, comma, Mrs. Ellis presented. Okay, you don't need to place a comma here. Why are you presenting the comma here? It is not needed. So you should say on admission, comma, Miss Ellis. Okay, let's say on admission, Miss Ellis. Okay, comma, this comma needs to be removed. You don't need to place anything here, please. So just write down Miss Ellis. That's it. Don't write down the comma over there. All right. Okay, sorry. Let me go to the first page. Yep. Okay. Okay, on admission, Miss Ellie presented with the complaints of abrupt onset of intense unilateral left loin and groin pain. Okay, radiating to back. Okay, right. So let's say you can use this one, groin pain, loin. That's all right. That's fine. Radiating to hair back or radiating to the back. Okay, you should use radiating to hair back or you know, the back. Okay, one of them. It's better to use to hair back. All right, but you can use to the back as well. Okay, right. Let's go to the next one. The above mentioned diagnosis was confirmed through computer tomographic scan and urine test. Okay, it's better to use the articles, you know, before them, through a computer tomography scan and a urine test. Okay, is that clear? Yeah. So you should say, instead of writing down computer tomography scan, you should say a computer tomography scan, and instead of writing down urine test, you should say and a urine test. Okay, is this clear?
Yes, sir.
Let's go to the next one. Okay. On assessment, vital signs were normal. Okay. On assessment, you need to place a comma after them, and you didn't place them. Okay. So you should say on assessment. Okay. You should write down like this: on assessment, comma. Okay. On examination, comma. On investigation, comma. On admission, comma. So all those on, wherever you know, whatever you use after them, if you use them in the beginning of a sentence, you have to place a comma after them. Do you understand?
Yes, sir.
Okay, good. Let's go to the next one. During hospitalization, comma, she was treated with the IV, and then that's the medication name, isn't it? Can you tell me the name of this medication? Is it diclofenac?
Diclofenac. Yes.
Yeah, and then IV fluids 2 liter daily administered. Okay. It is highly recommended not to use the abbreviations. Okay, it's better to use the intravenous. Okay, instead of writing down IV, I would recommend my students to use the full form of the phrases. Okay, intravenous, whatever it is, whatever they mention. Okay, intravenous. And yeah, again, you know, this one, 2 liter daily administered. Okay, intravenous fluids 2 liter were daily administered as well. Okay, because this is a different thing, isn't it? So you said she was treated with this one, that's fine. These are the medications. So you can say medications can treat her, you know, issues, that's fine. But these IV fluids were daily administered as well. Okay. So this is the administration. This is different from the treatment. Am I correct? This is the administration. So if you write down this administered, when you add it here, then this need to be expanded. Okay, instead of saying IV fluids 2 liter daily administered, instead of saying daily administered, you should use daily were administered, because sorry, just a second, were administered. Yeah, because okay, administered. Okay, so in this case you have to use the plural verb, because you can see this here, or IV fluids is a plural noun, so you have to use were daily administered. Okay, apart from this there should be a comma. Apart from this there should be a comma. Okay, apart from this, okay, you need to place a comma. Place a comma here. Okay, after that you should place a comma. Okay, apart from this, and then comma. All right, let's go through this tab. Tamsulosin 8 mg twice a day to aid, you know, spontaneous passage of calculus, and tab paracetamol 500 mg every 4 to 6 hours to relieve the pain where commenced. Okay, all right, let's say one thing is we should not use, you know, tab. All right, we should use, you know, tablet. Okay, the other issue is you shouldn't use the capital T here, because it's not the first letter, isn't it? So you should use tablet after the name of the tablet. Okay, don't write it down here in the beginning. Don't say tamsulosin. Okay, you should use tamsulosin tablet. That's it.
Okay.
Tamsulosin. Okay, instead of that you can say tamsulosin tablet. Tamsulosin tablet. Okay, this is much better. The same thing is applicable with the other tablet as well. I'll tell you this. Okay, all right, apart from this, tamsulosin tablet 8 mg twice a day to aid spontaneous passage of calculus, and tab paracetamol. So instead of writing down tab paracetamol, you have to use what? Paracetamol tablet. Yes, and you don't need to use, okay, tab paracetamol. Okay, instead of that, what you should have done is you should have mentioned the paracetamol tablet. Yes, okay, you should have mentioned that. All right, let's go to the next one. Paracetamol tablet where, okay, paracetamol tablet every 4 to 6 hours. Remember this, it's not hyphen. You should not use hyphen. It's not correct. You should use 4 to 6 hours. Okay. But the best thing is to use, sorry. Okay. So the best way to use is to write down in words 4 to 6 hours. This is what I would recommend. But in the worst case, you have to write down at least this one, 4 to 6 hours. Okay, don't use these hyphens and so on. It's not correct, because they were expanded already, isn't it? So you have to expand them. You can't just use these phrases. It's not correct. To relieve the pain where commenced, but it's all right. It's all right. I mean, apart from that, this sentence is okay. As per urologist assessment, okay, let's say urologist assessment. Okay, you said urologist. As per the urologist, okay, urologist assessment. As per the urologist assessment. Sorry, where is that? Not this one, sorry. Not this one, sorry. Oh, yeah, it's here. Okay. As per the urologist's assessment, stone will like to pass spontaneously within. No. Stone will likely to pass, isn't it? Is that what you want to say, right? Within next 1 to 2 weeks, the stone will be able to pass, in the urine, isn't it? Something like that, right? That's what they try to tell you. So this one is wrong. It's not will like to pass, will likely to pass. The stone will like to pass. No, will likely to pass. Okay. All right. Next one is what? Likely to pass spontaneously within 1 to 2 weeks. That's correct. Miss Ellis's condition. You don't need to say Miss Ellis's condition, but Ellis and then hyphen S. Okay, I will tell you what you have to do. Miss Ellis's condition. So you can say Miss Ellis, and then you can place an apostrophe. That's it. Ellis condition. That's okay. All right. Ellis condition was improved and vital signs were normal. That's good. Based on aforementioned circumstances. Based on the aforementioned circumstances. And spelling mistake for aforementioned as well. It should be F-O-R-E. All right. Based on aforementioned. Okay. Let's say aforementioned. All right, this is wrong. So look at this. It changes, right? Isn't it? So if you write it down, sorry, you have written on this one, but it is incorrectly spelled. So how do we need to write it down? We need to write it down initially the, and then we have to write down aforementioned. Okay, it's going to be A-F-O-R-E, aforementioned. Okay, that's the correct spelling. All right, let's go to the next one. Based on the aforementioned circumstances, it would be greatly appreciated if you could. Okay, greatly is not needed. It's no longer needed. Okay, greatly appreciated. You can remove it, but it is not a grammar mistake. Okay, it's not a grammar mistake, please. It's not a grammar mistake. You can still get marks if you use it, but it's not recommended. Okay, if you could. Okay, when you write down if in the second part of the sentence, it's not needed. Okay, you don't need to use the comma over there. Appreciated if you only use if in the beginning of a sentence, you need to place a comma after the first part, whereas in this case it's not needed. You can just say if you appreciated if, that's it. You don't need to use anything else. Okay, right. Let's go through that. If you, and then we'll go to the next one. If you could monitor, okay, let's say if you could monitor her medications compliance, that's wrong. Medication compliance, that is okay. All right, not medications compliance. It's medication compliance. Medications compliance. It's going to be medication compliance because it's a singular action. Okay, it's a singular noun. Okay, so you don't need to write down all of them. Increase fluid intake. Is it a comma? Is there a comma or is it a full stop?
Compliance full stop.
Full stop. Okay, increase. You can't start a sentence with the verb like increase. Okay, increase. Okay, also please increase. Okay. All right. Okay, let's go to the next one. Also please increase fluid intake. Okay, fluid intake 2 to 3 liters daily, isn't it? Why are you writing down suggested here? I don't know why you have written down here. So 2 to 3
Passive
liters.
voice.
Then you have incorrectly used it. Okay, I will tell you. I'll tell you what you should have done. Okay, it's like 2 to 3 liters. You can write like this. Or in the worst case, okay, what you should have done is in the worst case, 2 to 3 liters. Likewise, okay, there should be a space here, sorry. 2 to 3 liters like this. But passive voice is not when you start a sentence with the verb here in the beginning. No, it's not. I will tell you what you could have done. Okay. Increasing her fluid intake to 2 to 3 liters daily is suggested. Do you understand what I mean? This is how you should have written on. Increasing her fluid intake to 2 to 3 liters daily is suggested. All right, that is the correct sentence, but you haven't written down. So the suggested needs to be removed in this case because you are writing down the sentence using the active voice in this case. So suggested, remove this phrase, please. Remove this phrase, please. Okay. All right. Monitor urine output again. It's not good. Okay. And unmonitor, you should have mentioned unmonitored urine output, and to use of sieve to check passage of stone. Okay. And use it should be, so she's going to monitor urine output and then the use of sieve. Is that correct? Both of them, am I right? Yeah. Okay. So if that's the case, don't use and. Okay. And sorry, not and to. So okay, let's say and to use and the use of. Okay, that is perfect. So don't say and to, it's going to be and the use of. And the use of sieve to check passage of stone, that is 10. Okay, that is to send urine sample for lab analysis where recommended. No, this is wrong. This is wrong. The whole thing is wrong. I mean, you have used both the active and passive voice together, and then you have written down a completely incorrect sentence. So this is wrong. Okay, the whole sentence needs to be rewritten. I will tell you how you can do is, okay, you can say all, if you want to write down the active sentence, you can write like this. Also, please increase her fluid intake to 2 to 3 liters daily and monitor her urine output and the use of sieve to check passage of stone. Okay, and then you can say, you know, a urine sample will be sent to the lab for analysis. Okay, that's fine. So you can write it down in the next sentence. All right. If you commit a lot of mistakes when you write down the longer sentences, I would recommend you not to do that, please. Okay, don't write down longer sentences. The sentences that are 2 sentences long enough are okay. You don't need to write down like this. This is wrong. Okay. It is necessary to the dietitian should monitor low salt intake, maximum 3 gram daily, and to avoid excessive intake of oxalate rich foods such as nuts, soy products, and wheat bran. Okay, and to limit animal protein intake to, okay, this he's going to intake to 1.0 gram per kilogram body weight. Okay, let's say it is necessary to the dietitian. It's not necessary to the dietitian. Okay, it is okay, this is wrong. It is necessary that the dietitian should monitor low salt intake. There should be a hyphen as well. There is a lot of grammar mistake here. To the dietitian. Okay, let's say for the dietitian. For the dietitian. Okay, and let's go through this. To the dietitian, spelling mistake, it should be DIETIAN. Okay, should monitor. It is necessary for the dietitian to monitor. It's not should monitor. Should monitor needs to be replaced with the to monitor. Okay, to monitor. All right, let's go through the next one. To monitor low salt intake. Low salt is going to have and hyphen in between because it's going to be one word only. So it should be low hyphen salt. This is how you need to write down. Okay. And then the next one is low salt intake, maximum 3 gram daily. Sorry, it's here. Low salt intake. Low salt intake maximum 3 gram daily and to avoid excessive intake of oxalate rich foods such as nuts, soy products, wheat bran, and to limit animal protein intake. Okay, right. The problem is you have used and several times, which is not good in this sentence. You could have split this into 2 sentences, please. You know, we need to ensure that we are not exposing our mistakes to the examiner. Do you understand what I mean? So we will reduce our mistakes. We will not give you know, the room for the examiner to deduct the marks, you know, based on the mistakes that you commit. It's not good, right? So okay, animal protein intake, it's not just intake, but it needs to be intake 2. Okay, intake 2, because you need to limit it, right, to something, to some level. All right, body weight. Okay, she has follow-up appointment. Sorry, follow-up outpatient urology appointment on. Okay, she has a follow-up. She has a follow-up. Okay. She has, it should be she has a follow-up. Okay. That's what you should write. Okay. She has a follow-up outpatient urology appointment on 20 July 2018. That's fine. Should you require any further information, please do not hesitate to contact me. That's all right. There should be a comma here. You have placed it. Good. Yours sincerely. Do you know the recipient of the letter? Do you know the name of the recipient?
Yes.
Yes, in this case, right? You know the name, right?
Mm,
If that's the
yeah.
case, it's okay. Yours sincerely, and then you can say charge nurse, medical ward. That's fine. You don't need to mention the medical ward. For charge nurse, it is better to write down the charge nurse because it's more formal. Okay, do you understand? You
Mm,
can say the charge nurse. This is not a mistake. Okay, I don't take it into the assessment. Okay, that's fine. All right, let me go through the assessment now. One thing is grammar needs to be improved a lot. Okay, particularly use of article, everything needs improvement. Use of articles, nouns, verbs, okay, prepositions, punctuation marks needs to be improved. Okay, the second thing is you should have used a passive voice form rather than the active ones. Okay, more frequently and correctly. It's very important. Correctly. All right, one you have used wasn't correct. Okay, and the other thing is okay, what else? Vocabulary could have been much better. The use of more formal words. Formal words. Okay, you should have used more formal words. Okay, connectivity is not that bad. It is okay, but you could have used more connecting phrases and then split up. Okay, shorten the length of the sentences. You're right. Okay, split one long sentence into several small sentences, maybe two small sentences. Okay, overall task fulfillment is okay. I'm happy with that. Layout and presentation are okay. It's not that bad. Okay, both of them are okay. All right, use of a range of sentences is okay. However, you have committed grammatical mistakes when you have used a range of sentence structures, right? So it's better you have committed grammar mistakes. And you have written longer sentences. So it's better to avoid writing down the longer sentences. Okay, let me quickly go through the case notes and see if you have included all the relevant case notes or not. Okay, right. So that's the one. Okay, using this information in the case notes, write a letter to Mr. Paul Farris, manager of Somerset Nursing Home, Gordon Street, Berrytown, who will be responsible for Mrs. Ellis' continuing care at the nursing home. Okay, that's fine. Okay, so it's a nursing home. So is it a known case or an unknown case? Is she going to be transferred to the same facility? Oh yeah, no. Oh yeah, that's right. Yeah, so you don't need to include the social or the background for the medical background. That's okay. I'm happy with that. That's fine. All right, renal colic. Yeah, you have mentioned these things. The diagnosis, the date. That's all right. You don't need to worry about the marital status, residence, and everything. Next of kin. No, nothing is needed from the social background. Nothing is needed from the medical history as well. That's good. On admission, so you have included these things. Okay, I'm happy with that. And then this one is also fine. CT result showed bilateral multiple brain calculi. Yeah, that's all right. For obstructing pelvic. Did you mention this one? Hello.
yes, sir.
Yeah, did you mention this one? I think you don't need to. You didn't mention this one. For imam
Yeah.
obstructing. You should have
No,
mentioned
no.
this. You should have mentioned this. Okay. All right, 12 June, dehydrated, unable to take fluids. Okay, that's all right. Okay, so that's fine. Medications part is okay. Medical progress, that is all right. Respiratory progress, that's okay. Assessment, that's fine. Patient fit for discharge with analgesia. To continue Tamsuline and paracetamol. Did you mention this one? To continue paracetamol and Tamsuline? I think you have
Yeah,
done
yeah.
that. Follow-up appointment, that's done. Patient is ready for discharge with analgesia. Did you mention that analgesia? No?
Yeah, that is paracetamol.
Oh, you mentioned, okay, yep.
Mm.
All right, monitor medications and pain relief, increase the fluid intake. Okay, try not to use the same words. It's not good. Monitor urine output, use of CO2, check passage of stone to be sent for lab analysis. Okay, monitoring by a dietitian, self intake of excessive rich foods. Okay, you have repeated almost all the words from the case notes. You haven't used their synonyms. That's another worrying situation for you. Okay, you have missed a few relevant case notes. That's not good. And the other thing is you haven't used the synonyms of the keywords of the synonyms of the keywords from the case notes. You have just copied whatever the words you have got in your case notes, which is not good, isn't it? Okay, let me go ahead with the score. Okay, taking into the account of all these things, you have committed so many mistakes, 35 mistakes. I think this letter wouldn't be able to get you more than 250 out of 500, according to me. Okay, don't get disappointed. You can definitely improve your skills. Okay, as long as you address these mistakes, one by one, you should be able to see improvement in your score in the following letters. Okay, don't worry,
Yes, sir.
because it is always good to find out the mistakes. You need to firstly know where you are losing your marks. Okay, that is important.
Okay.
If you get a detailed analysis like this one, you will be able to find it out, and then you can work out on them. Okay, so whenever you write down the next letter, you have to read these comments and then go through them and try to rectify them before you share them with me in the future. Okay,
Okay.
thank you so much. Bye.
Oh, thank you.